Progress. Control. Welcome everyone. We're just going to give a couple more minutes to allow folks some time to join on in. Thank you for making your way in. In the chat, Haley is posting a prompt there for you to be able to introduce yourself in the chat. And I'll give me about 1 more minute or so to allow time for folks to come.
Recording in progress.
All right, so we'll go ahead and get started. I want to thank everyone for joining in on our first Health Equity Action for Lactation Initiative stakeholder meeting. I'm happy to be able to share about the H.E.A.L project and do anticipate that we will continue to hold stakeholder meetings where we're able to share about the project. So definitely appreciate everyone for joining in on our first one. So before I dive into the H.E.A.L project, the team, and so forth, I want to make sure to honor and hold space for the fact that, we are still balancing the realities of today. We're in a mixture of still doing virtual with some hybrid going in office, that life is still happening around us. Happy moments, moments that make us emotional, different things, are contending with how we show up in spaces, and being sure to recognize that we're all kind of coming into this space with other things that, we juggle and prioritize. Also recognizing that it's about 1 o'clock on Eastern time. So many of you had a lot of meetings today, might be trying to fit in some lunch. And so definitely understand that. So I wanted to just recognize the balance of it all that each of us are contending with outside of being here in a Zoom meeting, and just want to recognize everyone for this moment. So with our agenda for today, we will be doing a welcome. I do ask that if you are not speaking to please mute. We are recording this meeting. So we are going to go through a little bit of a welcome, a review Rose, Reaching Our Sisters Everywhere mission, the H.E.A.L team that's working on this project. Go into what the H.E.A.L strategy activities are, so everyone on the call can have a better understanding of this initiative and project, ways that you all can engage with H.E.A.L will be next, and then an opportunity for thoughts and conclusions at the end. So as mentioned, we are recording this meeting. So if you have to step away for any reason, or if there's other colleagues that you feel should hear this information and messaging, do not fear. This is being recorded, and we do intend to have it available on the H.E.A.L website page. Also, please, once again, be sure to mute your mic when not speaking, just to make sure that as it's recording, all the audio is being able to be heard well. So I would like for you, if you haven't done so already in the chat, to go ahead and please tell us your name, the state that you're in, the name of the organization, if you are connected to one, as a way so we can know who all is in the room. Once again, I welcome you and thank you all for joining us today. And shortly, we'll have a poll that will appear on your screen. And this poll is kind of similar to the questions that were asked during your registration for this meeting. So your stakeholder identity. For this one, we are asking you to select your primary stakeholder identity when the poll comes up. I know that each of us may wear different hats and show up to spaces in different ways. For this particular poll, if you can just identify one when it does appear on your screen. And know that this list is a little bit more condensed in comparison to the one that was used when registering, because Zoom has their limits. So wasn't able to put all the options that were initially listed there. So I'll give a moment for Haley to bring the poll up, and while she's doing that, feel free to chime in into the chat.
Andrea?
Hi, Dr. Bud.
Hey, I just want to say hello for a second, okay?
Yes.
All right. Good morning or good afternoon, everyone. I'm not going to be able to be in this space with you this afternoon, but I just wanted to, this is Dr. Kimmery Bug, just wanted to say how much we appreciate you. We are grateful for your advice and your information and resources to share with us so that we can get this right for the families that we serve. So thank you so much for agreeing to be a part of this, and we will keep you informed every step of the way. Have a great day. Thank you.
Thank you, Dr. Bug. All right, so it looks like a solid amount of folks have completed the poll. I might give a couple of more seconds for any last responses. All right, and then we'll go ahead and end the poll so we can kind of all see who is in the room here. All right, so thank you all for, selecting your primary identity. And not too surprised here by who's all in the room. Got a preview of it through the registration. So once again, definitely appreciate being able to have such a variety of stakeholders attending this first meeting. All right, so we'll stop sharing and we'll close out here and we'll go on. So if you aren't familiar with Reaching Our Sisters Everywhere, I wanted to be sure to share our mission. Reaching Our Sisters Everywhere was founded to address breastfeeding disparities for communities of color. Rose works to normalize breastfeeding by providing resources and networking opportunities for individuals and communities. As a national expert, and in partnership with communities, we build equity in maternal and child health through culturally competent training, education, advocacy, and support. Our Rose team is comprised of all of these phenomenal individuals. I'm Andrea Serrano, the Director of Programs that is speaking with you today. Dr. Bug, our CEO and President of the organization, gave her intro. Ms. Jackson is our VP of the organization and Director of Community Engagement. Many of you all may be familiar with George Wesley Bug, who's the Director of ROBE, Reaching Our Brothers Everywhere, and our Operating Officer, Haley Neely, who's also on the call, is our Development Director and kind of helping me look at the chat. So any questions that come up, she'll be able to flag them for me. Tanisha Sellers, our Community Transformer Coordinator. Mia Burrell, Finance Manager. Carl Root is our Role Community Transformer. Courtney Carter is our Communications Manager. And Jade Harris as our Executive Assistant. For this project, we had to connect with some phenomenal contractors to help us facilitate the H.E.A.L project. So these lovely individuals are providing their expertise and guidance as we navigate developing and implementing the H.E.A.L project. So let's dive into what is H.E.A.L. H.E.A.L stands for Health Equity Action for Lactation. It is an initiative that we have developed to help work towards addressing breastfeeding inequities for Black families. So the CDC data is clear that 60% of mothers do not breastfeed for as long as they intend to. When we look at breastfeeding rates for Black families, we see that 75.5% plus or minus 3 are ever breastfed. And so we do celebrate that because it is recognizing that a majority of Black families do start breastfeeding. When we look at the most recent breastfeeding report card, we see that although we are celebrating that the majority of Black families do start breastfeeding, there still lies an inequity gap between any breastfeeding rates for Black families in comparison to other race racial and ethnic groups. And when we look at the duration, which if we follow this line here, those inequities continue to persist. And so the efforts and the work around the H.E.A.L project is specific to addressing the inequities in breastfeeding rates and helping to assure that families, particularly Black families, are reaching their breastfeeding goals. If you are familiar with any of our prior work, one of the resource documents that is available on the Rose website is our Saving Tomorrows Today, an African American Breastfeeding Blueprint, which was a resource that consisted of qualitative and quantitative data and assessment of how breastfeeding is going in our national landscape. And when we look at inequities in breastfeeding, we see that some of them are region specific, with the Midwest and the South having some of the larger inequity gaps in breastfeeding rates. And from PRAM's data, the Pregnancy Risk Assessment Monitoring System, pulling data from that resource, we were able to see that breastfeeding rates for African American Black families decreased by about 21% each week in the first 4 weeks. So equipped with a lot of this information, and this is, data that is prior to the impact of the pandemic, right? So these are inequities that existed prior to the pandemic. Through the pandemic, work that Rose has done in collaboration with, many of you on the call, have surfaced a lot of stories and the impact that, the pandemic and different policy and practice changes had on maternal and infant care. And so we are definitely curious to see what that impact, continues to be on our communities. We know that there has been some recent studies, that show the maternal health impact of the pandemic, particularly for Black families. And so keeping some of those things in mind as we develop this project, we really wanted to assure that how we approach these efforts are intentional and working to better support families in their breastfeeding goals. So our H.E.A.L strategy that we are going to be working through over the next 4.5 years now, it's a 5-year project, is strategy 1, develop and facilitate a national community of practice to use and disseminate culturally centered breastfeeding materials, support evidence-based breastfeeding practices in maternity care, and enhance training for medical and lay support of African American mothers and their infants. Strategy 2, expand the perinatal community health worker collaborative that incorporates culturally centered breastfeeding materials into direct service support to pregnant and parenting women and their families. And strategy 3, develop and execute a national digital media campaign to promote culturally centered breastfeeding support materials. So these are our 3 key strategies that we'll be utilizing throughout the course of this initiative. Our H.E.A.L priority communities are perinatal Black families, community health workers and organizations, and healthcare providers. Particularly for perinatal Black families, Rose will provide prenatal and postpartum resources and education to help encourage and promote and support breastfeeding initiation duration. We hope to work collaboratively so that way pregnant families can learn about the benefits of human milk and breastfeeding practices while utilizing breastfeeding resources such as It's Only Natural, supporting nursing moms at work. And Rose will work to continue to educate peers, partners, and family support individuals such as grandmothers on the importance of breastfeeding, how they can support those in their lives that are providing breast milk. For our community health workers and organizations, we hope to conduct some community outreach programs, highlight how community resources are created to help combat, some of the negativity around breastfeeding in public spaces. And when working with community programs, not only those that are specific to birth and maternal work, but those that just serve families directly that are within our priority community. And then healthcare providers, being sure to lift up the resources and evidence-based training around providing culturally centered lactation support and the resources that they can distribute to the families that they're serving. So these are our key priority communities that this project is working with at the center being perinatal Black families. Our key aim with H.E.A.L is to improve breastfeeding initiation duration for African American Black women and families. That is what we hope to achieve towards the end of this project through what we seek to be a large collaborative with partners. And of course, at the helm of the work, Black lactating and pregnant families. So for year one, which is what we're currently in, you haven't seen us do a lot of outward mobilizing as of yet because year one is really centered on us listening and assessing. This is key to making sure that what is developed as an implementation plan is intentional and really leans on the needs that comes from our priority populations. So we'll be doing some stakeholder assessments of breastfeeding resource materials with pregnant, lactating, parenting families, fathers, partners, and grandparents, community support providers, public health workers, medical providers, and government partners. So these will consist of listening sessions, interviews, and so forth that we have already began plans for. We'll also continue to promote existing breastfeeding materials that prioritize African American families amongst the community and public health networks. And then at the conclusion of year one, we will be distributing that assessment and recommendations to informed updates. And so that assessment will come from the work we did around this the listening sessions and interviews. Our listening sessions we plan to begin them in May through June of this year, 2022, with our priority communities that I previously mentioned. They will be about an hour and a half long, and we will, of course, provide incentives for those that participate in the listening sessions. We do have our groups parsed out to ensure that we are kind of getting a nice, well-rounded perspective on how the effectiveness of materials, where families expect to see and obtain materials, and also where they seek to get resources and
Thank you, everybody. Give us a couple seconds to work through this technical difficulty. We will be right back.
Hello, everyone. This is Wesley Bug. Haley, we might want to stop recording, but if we want to keep recording, if you had any questions or concerns, those could be addressed.
As you. Okay, so thankfully I know where I stopped because the power went out in the house, so I have a hot spot, and we will continue because I do want to make sure we do get an opportunity for thoughts and discussion. So we wanted to share the information about the listening sessions because we will be pushing it out to everyone that, join the call, so you can invite or even fill out the form to participate in a listening session. So we just wanted to put it on your radar to let you know that those are coming up soon. Other things we wanted to share are ways that you can continue to engage with H.E.A.L moving forward. And so our stakeholder group, this is what the stakeholder group is here. So moving forward, we definitely hope not to be fully just a share of information to you all throughout the entire time, but essentially they will be quarterly program updates where we kind of share where things are in this project and initiative with updates. And then where you all can learn about ways how to support, just like how I lifted that we'll be having listening sessions coming up soon. And then also maybe opportunities where we can share things that are synergistic to this work as well. So we definitely invite you all to continue to engage in the stakeholder meeting updates. The next way to engage would be advisory groups. So advisory groups provide insight into the project from lived experience, our subject matter expertise, and serves as resources, our sources for answering questions, our resources in support of the project. Currently, we do have a lived experience advisory group comprised of lactating and pregnant women who are able to kind of give insight on how they expect to obtain resources and type of information that they would hope to see on a resource. We definitely would like to continue to grow our lived experience advisory group and additional advisory groups that are centered around other subject expertise as well. Then implementation partner. These are going to be partners who contribute to the implementation of the H.E.A.L project. Currently, we are anticipating implementation activities to really kick off in the spring of 2023, because we want what informs our implementation plan to be the things we pull from our assessments that we're doing this first year. So we didn't want to design a project and program to the detail and T without listening to our priority communities first as our lead, and ensuring that we are working intentionally around our efforts. So with that, we anticipate being able to begin these activities that are more specific to the actual project around the spring of 2023, and hope that with partners such as you all on this call, it helps to expand that reach along with being able to kind of fold some of the resources and tools within the work that you all do as well. And then we recognize that, sometimes engagement and, being able to sign on to something right away may, create some levels of, worry, like, do I have enough on my plate? So other ways that you can continue to engage with us is to follow us. Um, Join in on our e-newsletter, follow us on our Instagram and Twitter. So those are support_rose and support_rogue. Follow us on Facebook. So in the chat, Haley, if you can post a jot form link that is created. So this jot form link allows you to just indicate which ways you would like to engage. I promise you, this is not a contractually binding form. It just lets us know that you have interest in these particular areas. You're able to check more than one. And as we continue through this process in our assessments and so forth, we will start engaging a little bit more directly around these particular groups. So I will give a moment for that link to be dropped into the chat. And Haley, you should have got it in an email, the link. So while that link is being dropped into the chat, are there any questions so far about, ways to engage? Are there engagement opportunities that anyone feels is not listed here? So I'll give a moment for those responses, and you can come off mute if you would like to for that. Oh, you don't have to put anything in the chat right now. We're getting a drop form link that will be sent out for you all to engage with ways you want to engage. However, for any responses on if you feel that there might be other engagement opportunities that's not listed here that we should put on our radar. And thank you, Haley. She's dropped the link into the chat for our engagement form. So like I mentioned, this engagement form isn't binding you to these groups. We're not saying you fill this out and you have to now participate in this way, but it's letting us know that there is interest in working with us in any of these categories. And you are able to check more than one on that. So I'll give some time for that. Those to be able to go into the form and engage. And then I'll also open the floor for just any overall thoughts, questions around engagement. And I see those responses coming in from the job form. You guys, everyone here is awesome. Thank you all so much for filling them out. Sorry. And then really for our next slide is just being able to hear thoughts and feedback, questions. I see someone have asked what types of activities will be involved in implementation. So when it comes to those activities, we're really going to lean on the assessment reports that we're doing first to identify best activities to implement. So previously, when we did similar work around this project, there were community trainings that, our organization already did for families. And so we implemented some of the resource materials into those trainings as a means of disseminating breastfeeding resources and also being able to kind of connect with families that way. So that was one implementation activity that we had based off of existing programs. As we do our listening sessions and really hear how families intend to or how they seek to receive resources and support, where they plan to go to obtain resources and support, those things will help to delineate the kind of activities that need to be put into plan for the implementation. So we didn't want to just hash out and say, we're going to do these activities right off the bat without hearing from the community first on best ways to connect them to the resources that they seek. And then someone mentioned, in addition, any events occurring in the month of April, please share. Okay, thank you. Jay, can you please copy down the email for us there? For the government partners that are on the line, we also do plan to include you all in on listening sessions because we also like to hear best ways to get you these resources and materials and for you all to, share them as well. So you all are a part of an identified group for our listening session. And then someone asked, will safe sleep information be included as a part of breastfeeding information? So a part of our listening sessions is to kind of narrow those things down. So I hope that you hope to engage with us as an implementation partner, Veronica, because I think there's opportunities for that kind of collaboration. So for year one, our key theme for year one is listening and taking in this assessment as a way to more clearly define how we are going to implement this work. Other thoughts, comments, questions? So I do have one more poll that I'm going to share here. And we just want to have an idea of the primary priority communities that you all serve on this call. So I'm gonna launch the poll to show up in a second. This was multiple choice, so you're able to select more than one. And it's just an opportunity for us to, see who you all are. You all are engaging in the work that you are doing. Oh, thank you, Ngazi. And once again, I wish I could have put more communities here, but Zoom has a limit on how many options we can have. I definitely appreciate all understanding, as I understand that this is not representative of all communities that could be identified. Um, so I thank you all for that. It looks like just about good amount of folks have responded to the poll. Give a couple of more seconds. Okay, so I'll go ahead and end the poll. All right, we love to see it. We'll go ahead and share the results. So thank you all for sharing who your priority community, well, primary priority communities are that you all are serving. And we are so thankful for your time with engaging and listening in about the H.E.A.L initiative. Just to once again put it on your radar, we are planning to host our listening sessions between May and June. So be on the lookout for information as we begin to recruit for those listening sessions. And then of course, around September of this year is when we intend to put out our assessment and recommendations report that comes out from the listening sessions and interviews that we are doing throughout this time. For those that have selected ways that you intend to engage, we will parse through all that information, and we will certainly be touching base more directly around those particular engagement points to give more insight for each of those items. So I do thank all of you so much for your time in listening and your responses and choosing to connect with us. If you have any questions and would like to, get more clarity about anything, you're always welcome to email me at aserrano@breastfeedingrose.org. As I mentioned, this call has been recorded. It will be available on our H.E.A.L page that we have on the Rose website. So that way, if there's any partners, colleagues that you would have liked to share this information with, they can access it here. And I'm also encouraging you all to share it with those that work with families that have that are either pregnant or with children under the age of 2 who may not necessarily be in maternal infant health work, but are working with families within our priority population. So share this information with them as well. We really want to ensure that as we work to connect families to resources, that we are also expanding our network to work better in partnership with everyone with this effort. So I do thank you. I'm going to open the floor for any other comments, questions before we close out. Oh, thank y'all. I love seeing everyone's names in the chat. So many familiar faces. All right, well, with no questions, concerns, that concludes our meeting. Thank you all, everyone. Yes, Ms. Schulteis, we are excited for the Rose Conference. We'll go ahead and close out the call. Take care, everyone.